Hi. Well, I'm going to talk to you about how you go about self-diagnosing the cause for your low back pain. And I want to point out that a lot of what I'm going to show you is as much concerned with eliminating possibilities as it is about identifying the actual etiology. Often it's not possible to pin down a definitive cause. It's a truly idiopathic condition. But what I'm going to show you will hopefully allow you to eliminate some possibilities, and then what's left often is helpful in guiding you to get to the correct diagnosis, if a definitive diagnosis is even possible at all. So you'll notice that I'm sitting, and that's not because I'm tired. That's because I wanted to convey the point that one of the first things you should ask yourself is whether or not you're comfortable or more painful when you're sitting. So if you find sitting comfortable, particularly if you find yourself going into this type of flexed relief posture, then you can almost with 100% certainty eliminate the possibility that a disc herniation is the source of your pain. Now let me be very clear. You may have an MRI that shows a disc herniation at L4-5 or L5-S1, but, and I'll say this again, if you are comfortable in this flexed posture, if this is a relief posture for you, that disc herniation on that MRI is not what's causing your pain. Ask anyone that spends a lot of time around patients that have true clinically significant low back disc herniations. One of the first things they'll tell you is the patient never likes to sit. So if you are comfortable sitting, and particularly if you're comfortable in this really flexed seated posture, right away you've got yourself a good piece of information there that almost certainly your pain is not due to a disc herniation. Now what's left? What other possibilities are there? Well, people with spondylolisthesis often find this posture comfortable. People with stenosis, either spinal or foraminal stenosis, often find this posture comfortable. And some sacroiliac joint dysfunctions will claim that this is a relief posture as well. We'll talk about SI joint dysfunction in a little bit. Right, let's look at the possibility for extension. So, if you know that going into extension, anything back this way, or even on the floor, like this is a Mackenzie push-up. If those types of movements where you're going into extension, or could even be lying on your back over a Swiss ball, if those kinds of movements are very, very painful, and with repetition you get more pain, then obviously stop. And second thing you've learnt is that you're probably dealing with either a spondylolisthesis or some kind of stenosis problem, either a spinal or foraminal stenosis. So remember those two little tips. If it's comfortable in flexion, probably not a disc injury. If it's painful in extension and gets more painful with repetition, then it could be a spondylolisthesis or a foraminal or spinal stenosis issue. Now, if you run your fingers down your spinous processes, just take one finger and just work your way down the spinous processes. If you feel a step, and a step is basically this arrangement, where you feel one spinous process and then the next one down is further away from the middle of the body, so this is posterior, that's anterior. So you have this ledge here, and then that one sticks out and the next one below's in line and so on. That step could indicate a spondylolisthesis, which means that one vertebra has slipped forwards on top of the other. Those injuries are almost always very painful in extension, and flexion is often comfortable. A lot of people that have spondylolisthesis ride bicycles for exercise because being in that flexed posture is comfortable. Now, if you suspect that, the definitive diagnosis is pretty simple. It's a lateral x-ray done standing. So the camera would be where this web camera is, and you need to be standing. Don't sit, you need to be standing. And then you take a lateral view of the lumbar spine from the side, and you'll be able to see in the picture whether the vertebrae are stacked one on top of each other properly, or whether one slipped forwards. If you're not sure what you're looking for, then go online and search for spondylolisthesis x-rays, and there are pictures that come up that show you what a a spondylolisthesis looks like on X-ray. A good orthopedic specialist should easily be able to take that X-ray for you and interpret it if you're in doubt. Okay, so that's spondylolisthesis. Now, stenosis is a little more tricky. Stenosis, you won't feel a step. You'll have pain with extension, relief with flexion. The main thing that distinguishes it between spondylolisthesis and stenosis is the lack of a step. So in a spondylolisthesis, especially an advanced one, there will be a palpable step, which will not be there with stenosis. There is a test for foraminal stenosis. You stand with your arms crossed, you rotate, extend, breathe in, breathe out, and then you need a friend to stand behind you to pull down on your shoulders and hold it for about 10 seconds. And you figure out, does that create pain? If so, how much? Is it familiar pain? And so on and so forth. Then do the other side, cross the arms across the chest, rotate, extend, breathe in, breathe out. And then again, your friend is standing here between the camera and where I was, and is pulling down on your shoulders with about 30, 40 to 50 pounds of pressure downwards or force downwards. Again, hold it for 10 seconds. If that either recreates or exacerbates your pain, you could be dealing with foraminal stenosis. Okay, so we talked about disc injury. We explained that if you're comfortable in flexion, you probably don't have a symptomatic disc injury. We explained that if you have pain in extension, you may be dealing with either a spondylolisthesis or some kind of stenosis, either foraminal or spinal stenosis. Let's talk about sacroiliac joint dysfunction. Typically, people with bad SI joint instabilities will tell you that they get pain going up and down stairs. Often they have to walk sideways to get upstairs. So instead of doing the normal forward approach up the stairs, they'll have to go sideways like this to get up the staircase. And that's because the SI joints are, if I roll my shirt up, the sacroiliac joints are right here. There's my PSIS, those little bony bumps. And then just medial, just inside those bony landmarks, that's the joint line for the SI joint. And when you have an instability there, walking up and down stairs will create shearing in the SI joints and pain. Another thing to realize is that if you wear tight pants, they can be diagnostic too. If you wear particularly compression shorts or a tight pair of jeans with a belt cinched up, if you find that you have less low back pain when you wear tight pants or compression shorts, because of the push this way of the iliac bones onto the sacrum, that will restabilize your SI joint. And people with SI joint pain will often get less pain when they're wearing tight pants or belted clothing. So that can be another way to self-diagnose an SI joint problem. One more thing to remember, that with the instability of the SI joint, if you're bloated, in other words, if you, from the side, if your stomach always looks like this, that's usually because foods that you're eating are shutting off the deep abdominal wall. The transversus abdominis is the muscle in the abdominal wall that's closest to the visceral structures. That's very sensitive to pro-inflammatory foods. Things like grains, anything made with cow's milk, soy, those three things need to come out of the diet. And you should notice after a week or two of completely eliminating all grains, all dairy products, milk, yogurt, cheese, anything made with cow's milk, all soy products, eliminate all of that stuff, you should notice your stomach gets a little bit flatter. And if your back pain is less severe, then that confirms that you're dealing with an instability, probably of one of the SI joints, and it's secondary to what you're eating. It's extremely common because most people, particularly in America, are taught to believe that grains and dairy and soy are healthy for them, and in fact they're not. They're three of the most unhelpful foods you can possibly put in your body. And of course a side effect of eliminating this food is that you'll start to get rid of body fat around here as well and have better energy and so on and so forth. So there is a role of diet directly in the mechanics of low back pain in some of these cases. One other little tip for you as far as the sacroiliac joint goes If you go to someone who specialises in C1, C2 alignment, usually these are chiropractors or osteopaths, they typically market themselves as upper cervical specialists. If you notice that after getting your C1 and C2 aligned, you have less low back pain than normal, again, that's a good indication that you're dealing with an unstable sacroiliac joint. So then the question becomes, how do you make sure that these upper cervical subluxations don't keep recurring? And I have seen situations where just by cleaning up the diet and getting rid of the grains, the dairy, the soy, getting the stomach to flatten through better diet, I've seen instances where not only does the low back pain go away, but now the person doesn't have to keep going to an upper cervical specialist every week or two to get the neck realigned as well. So the two things do go hand in hand, because obviously the vertebrae in the bottom of the spine are connected by a linked kinetic system to the ones in the top of the spine. And if you have mayhem at one end of the spine, you'll also have mayhem created at the other end of the spine. So those are some hints and tips to help you figure out what is and is not causing your low back pain. I hope that's helpful.